Colon cancer is one of the deadliest forms of cancer today, but what many people don't realize is that this type of cancer is nearly 100% preventable. A colonoscopy not only detects cancer, but it can eliminate the chance of you ever developing it, pending your family history and other risk factors, which we're going to learn about today. Joining me now from Griffin Hospital are Drs. Harold Schwartz, the Chief of Gastroenterology, and colorectal surgeon John Aversa. Nice to have you here, gentlemen. Thank you.
Thank you for having us, Teresa.
Dr. Aversa, let's start with you. Tell me some of the statistics, how big of a problem this is.
Well, this is a very important topic. As you know, March is colon cancer awareness, and this is the second leading cause of cancer death in the United States for both men and women. Every year, there's about 150 new cases diagnosed, 150,000 new cases diagnosed, and about 50,000 people will die from colon cancer each year. And another way of looking at this is about 6% of Americans eventually will be diagnosed as having colorectal cancer.
And there are no symptoms.
There can be symptoms, but symptoms tend to be evident when the disease is more advanced.
Okay. And who is at risk?
Men and women are both equally at risk. There's slightly higher incidence in men.
Okay. And let's talk about the screening process. At what age should you get a regular screening?
So average risk would be considered 50 years old.
Okay.
That's not to develop colon cancer. Actually, most colon cancers, if you take an average, would be somewhere in the early 60s. So the whole point is to be able to find precancerous lesions called polyps at an interval where they're still removable and don't develop into cancer. So in most other types of cancers, when we do screening tests like breast or prostate, we hope to find the cancer at an early stage, take care of it and treat the patient or cure them. The paradigm's different in colon cancer. What we do is called, instead of diagnostic screening, we're doing preventive screening, because it's one of the only cancers where you can find a benign precursor lesion that if you can remove it, you can prevent the cancer from ever happening. So colonoscopy really is the study to do that. You can examine the entire colon in a matter of somewhere between 10 and 20 minutes. A good, careful colonoscopy with a good clean out should be able to prevent colon cancer by removing all polyps in somewhere around 90% of cases, not 100%.
But there are some misconceptions that it's uncomfortable, maybe embarrassing. What do you say to people that say that to you?
Most people will opt for sedation, sometimes given by an anesthetist or anesthesiologist, sometimes not. I think that with these medications these days, you really don't experience any discomfort. You do have to inflate the colon with air. Afterwards, it can be a little bit gassy or uncomfortable. And we try and take the air out before we leave so that prevents some of that. So I think that's really gone by the wayside. The discomfort is really a thing of the past. In terms of the embarrassment, the fear, well, those are things you have to sort of get over and sort of, I think, maybe realize that one day of that is worth it for 10 more years or the rest of your life. I mean, I ask patients, if we could do a test on you that would prevent you from getting cancer, would you go for it? I've never heard anybody say no.
Right.
We do have a test. It's not every cancer, but it's colon cancer. And if we could do that on the entire population, we can almost eliminate the disease.
Sure. And Doctor, let me ask you, how much of a play does family history
Family history is one of our major risk factors. When you have no family history, we classify you as being average risk. Okay. Family history changes your risk to increased risk. Exactly how much that increases the risk is unclear. But specifically, if you have a first-degree family member, like a mother, father, sister, brother, that changes when we might initiate your screening. We would initiate your screening earlier in that case.
Got it. Okay. And Dr. Schwartz, let's go back to you. Walk us through the procedure, if you would.
Sure. Well, the most difficult part is probably the day before.
Okay.
And that's the day where you have to clean your colon out. There's nothing magic about that. If you're gonna do it, you have to do it aggressively. Drink a lot of liquids. There are various ways of doing that, but all of them entail drinking some substance it's called a purge laxative, that will be performed usually the evening of and the morning of the test. It's split. It works better that way, and it's more tolerable. The test itself, you'll probably come to if we do it at Griffin, you'll be checked in, you'll have an interview with a nurse, an intravenous will be put in, you'll meet the anesthesiologist, you're taken into a room, we greet you nicely, ask if you have any questions, sign a consent form, and then that's the last thing you remember.
And you'll fall asleep through the whole thing, right?
Now, our job at that point is to do a careful, gentle procedure that examines the entire lining of the colon. And as I said, it takes about 15 minutes on average. These days, we do a little bit longer tests than we used to because we really want to prevent every cancer by catching smaller and smaller polyps that we now know could have been hiding there had we not done a careful examination.
All right, and in the worst case scenario, there are plenty of treatment options at Griffin Hospital.
Yes, so treatment is, surgery is still the mainstay of treatment. And there's been many advances in surgical care, specifically in the field of minimally invasive surgeries and laparoscopic surgeries. At Griffin, we are employing most of these very advanced laparoscopic and minimally invasive techniques, including techniques of incisionless surgery for treatment of certain low-grade rectal cancers. And at Griffin Hospital, we have the state-of-the-art cancer center, and we take a very multidisciplinary approach where we actually have meetings 3 times a month and present patients that are newly diagnosed. And every clinician who's involved in the care of these patients attends the meetings, and we make sure the patient's going to have the state-of-the-art care for their cancer.
Sure. All right, and part of the Healthy Youth series, we're offering Tuesday Talks in March, the 11th and the 25th.
Correct.
That sounds like we'll get all the information we need there. The information's on the screen, and of course you could contact Griffin Hospital Digestive Disorders Center. You can call 203-732-7423 or visit griffinhealth.org. Doctors, thank you so much for the information.
Thank you for having us.
Thank you.